Welcome to day 22. Today's question was a young female with abdominal distension adnexal mass. Gross picture showed a multiloculated cyst and the microscopic picture showed a mucinous lining. So it is mucinous cyst adenoma. Your ovarian tumors are classified based on from where they are derived, from the surface, from the stroma, from the germ cell or from outside as metastasis. So they are classified into epithelial, sex cord stromal, germ cell tumor or mixed cell type. Epithelial again divided into serous, mucinous, endometrioid, clear cells. Surface epithelial tumors, they are the most common primary neoplasms. And there are three major histologic types: serous, mucinous, endometrioid. Serous tumors, they mostly include the common malignant ovarian neoplasms. They are frequently bilateral and account for 40% of all cancers of ovary. They may present as a multicystic lesion. The benign ones are smooth, glistening cyst wall. Microscopically, they are lined by columnar epithelium. Borderline have complexity, but there is no invasion. The high grade ones have more complex growth patterns and psammoma bodies may be seen. This is a gross picture of a serous cyst adenoma. You can appreciate the tense, glistening cyst wall. This is again serous cyst adenoma. The microscopic picture looks like this, lined by low cuboidal or columnar epithelium with cilia. This is a papillary serous cyst adenoma with solid cystic components. Papillary cyst adenoma borderline with more solid papillary areas. Papillary cyst adenoma, you can appreciate the papillary fronds. Bilateral cyst adenocarcinoma, more solid areas means more malignant. Again, this is cyst adenocarcinoma, predominantly solid. Serous cyst adenocarcinoma looks microscopically like this. Then the mucinous tumors. They are less common than the serous. They are multiloculated, filled with sticky gelatinous fluid. Microscopically, they are lined by benign tall columnar epithelium with apical mucin of gastric or intestinal type or endocervical type. Borderline or mucinous carcinomas can also be seen. This is how it looks like: grossly multicystic delicate septa and microscopically columnar cells lining the cyst wall. Grossly, you can appreciate the multiloculated cyst filled with thick mucin and microscopically lined by columnar epithelium with apical mucin. A word about pseudomyxoma peritonei, where the peritoneal cavity is filled with mucinous material. Endometrioid ovarian tumors are also a type of surface epithelial tumors. So also are clear cell carcinoma of the ovary. Transitional or Brenner's tumor are also there. Clinical code 125 is used to monitor the disease recurrence or progression. All produce roughly similar clinical manifestations. Sex cord stromal tumor, remember Meeks syndrome, a triad of fibroma, ascites and right-sided hydrothorax. Germ cell tumors, they constitute 15 to 20% of ovarian tumors. Teratoma, dysgerminoma, yolk sac tumor and mixed germ cell tumor. Classified into mature and embryonal types of germ cell tumor. Teratomas, mature, immature and monodermal. This is a cystic teratoma. You can appreciate hair in it. Mature benign teratomas are also called dermoid cyst because they are derived from skin-like structure and they are more common in young female. Morphologically, they are bilateral. They are unilocular cysts which contain hair, sebaceous material, tooth and keratin. They are cystic teratoma. You can appreciate hair tuft and other structures. This is the Rokitansky protuberance. You can appreciate a tooth in it. This is the lining of stratified squamous epithelium with skin appendages. Monodermal teratoma, only one mature tissue is seen, struma ovari, ovarian carcinoid. Immature teratoma, They are immature tissue derived. Dysgerminomas are ovarian counterparts of testicular seminomas. 50% of malignant ovarian germ cell tumors are dysgerminomas. They are composed of cells with sharp cell borders, and yolk sac tumors are endodermal sinus tumors. Characteristic histological feature is Schiller-Duval bodies, and they elaborate AFPs. Granulosa cell tumors, they are estrogen producing tumors. They stain positively with inhibin, and the tumor cells secrete estrogen. Call-Exner bodies are characteristic of granulosa cell tumor. Krukenberg tumors, they are bilateral metastatic tumors composed of mucin producing signet ring cancer cells. They are usually derived from the uterus, fallopian tubes, ovaries, breast or GIT, stomach. Thank you so much.
So this is a mucinous cyst adenoma. You can see these are very large cysts, and if you see inside, they are multiloculated. There are numerous multiloculated cysts attached to the inner wall, and if you see closely, the contents are thick viscid mucus. So this is thankfully a benign cyst. They achieve huge sizes. This is the range. This is also a small mucinous cyst adenoma. So the size can range from small to very huge ones. This is a serous cyst adenoma. So mucinous cyst adenomas are multiloculated. Serous cyst adenomas are usually unilocular. You can see there are no other septations, no other locula. So they are uniloculated. If you see closely, there are solid areas in this particular cyst, and there are small papillary excrescences. So microscopically, this one turned out to be a borderline serous tumor. This is a simple serous cyst adenoma. Again, you can see it is uniloculated cyst. This one is a classical mature cystic teratoma. If you look closely at the cyst contents, you can see a tuft of hair, you can see keratin or sebum attached to the wall. There are adipose tissue areas. Then there is this ridge. So this is a mature cystic teratoma. Another very simple cyst, commonly seen, simple benign cyst, common presentation.